Good afternoon, everybody. We have to start this session. It is about artificial intelligence. The first speaker is Professor AHMED SERAFY, Professor of Radiology, Suez Canal University, Ismailia. He is a visiting professor in Hurghada University and Gulf Medical University. He is the CEO of International Radiology Center in United Arab Emirates and is the CEO of Meridian Healthcare United Arab Emirates. He is the Secretary General Emirates Osteoporosis Society in United Arab Emirates also, and Director for Computer-Aided Implantology in Egypt.
Sorry.
Okay, no problem. You can start, Professor.
No, actually, I am trying to go back. Sorry about that.
Professor Ahmed will speak about the AI in imaging and overview. Please, Dr. Ahmed.
Dr. Mohammed, thank you very much for the introduction. And we have a new pointer today, that's why the confusion. The subject of my talk today is about something smarter than you, smarter than me, smarter than all of us put together: artificial intelligence. Artificial intelligence has been growing at such a phenomenal pace in the past few years. It can digest data millions of times that we can. It can see better than we can. It can hear better than we can. In fact, if I were to name a technology that has totally changed our lives in the 21st century, it would be artificial intelligence. With that in mind, I believe it's really important to provide an overview of artificial intelligence, to discuss its different concepts, and to see how this impacts our lives. And I would like to welcome to my presentation, which would take about 16 minutes of your time, hoping that by the end of that you would have a better idea of artificial intelligence and how it will affect our careers. The agenda is relatively short. I'll start with a brief introduction, mostly history of AI. Then I will give some examples of how AI is impacting medical imaging. And I will close my presentation with a couple of slides reflecting on how AI will change our lives. Any good introduction needs to have a definition at the beginning. And there are so many definitions for artificial intelligence, but the one I like the most is the simplest. AI refers to computers capable of intelligent behavior, mimicking that of humans. So this is really the simplest. Do not go for complicated definitions. How did AI start? The idea of having computers think was first proposed by Alan Turing in a paper he published in a journal of philosophy in 1950, posing the question, can machines think? And that really ignited the field of research on artificial intelligence. The term itself was coined by McCarthy and Marvin Minsky in 1956 in Dartmouth. And in that conference in Dartmouth, the foundations of AI were found, but they were just theories. And we really had to wait for over 50 years to see these theories put to practice. Why? Because there were so many things that needed to come together to constitute the ingredients for AI. These ingredients include big data, machine learning and deep learning algorithms, in addition to computer power. None of them was available till the early years of this century, so just over 20 years ago. The big data became available through the work of 4 men. Cerf introduced the internet to the general public about 25 years ago, and with this, big data became accessible. then these two people, Luke Kuhn and Jeffrey Hinton, actually devised deep learning algorithms, the neural networks, which are essential for making computers learn. And Jensen Huang, not talked about so much, but he actually invented the GPU, the graphics processor unit, the ultra-fast processor units. You kids probably know these processor units as the NVIDIA cards they're using in their gaming computers. If it were not for him inventing that GPU, I don't think we would have seen artificial intelligence till now. So these four men actually brought forward the ingredients that made artificial intelligence a reality. However, their efforts were tested by one woman, Fifi Lee of Stanford, who was obsessed with the idea of machine vision or computer vision. She posted on the internet every year since 2009 a competition presenting over 20,000 images from all walks of life and asked programmers from all around the world to submit algorithms, software that can classify these images. And to classify, you need to identify. And if you want to identify, you need to have the ability to recognize patterns. So these were pattern recognition algorithms that were handcrafted by developers from all over the world. First couple of years, the results were not really very encouraging. We had a lot of contestants, all of them submitting software that was manually created through writing thousands of lines of code. And the error rate was quite high. The best algorithm had a 28% error rate in recognizing images. Following year wasn't really much better with 26% error rate. And this was the capability of handwritten programs to recognize images, to recognize patterns and categorize what's in an image. Not very encouraging. However, in 2012, something incredible happened. An algorithm that was not created by humans, but was created by another software. So that's a software created by software. No human involvement, was able to beat every other contestant in that competition. That algorithm, that piece of software created by software had an error rate of 16%. And that's a massive, massive improvement over the previous year and the year before. From there on, this year was recognized as the big bang of AI, where programs created by machines were better than programs created by humans. Anyway, these programs created by machines kept improving, and by the year 2015, only 3 years after the first time a program was introduced, we had programs, we had applications that were actually better than humans in recognizing what's in an image, recognizing speech. So two of humans' most important sensory aids were rendered to machines. So now machines by the year 2015 had sensory abilities better than us humans. And this is 8 years ago. Now, 2023, they are vastly better than us. So just think of that. Now, machines can see better than us, they can hear better than us. Now, you might ask yourself, what's in it for me? There's so much going on for us. In fact, each and every one of you is using AI every minute of the day. When you wake up in the morning and you reach for your phone, provided it's a smartphone, and I think most of you have smartphones, you're not going to access anything in that phone unless that phone recognizes your face and unlocks. This is AI. the way you interact with your social media, the feeds you're receiving on your social media, even your mental state is monitored by social media based on AI algorithm. Voice recognition, for those of you who have Alexa, airplanes, autopilots are AI enabled. Google Maps, this is an algorithm that's run based on AI. Your Google search is based on a profile that Google has on you that it has built using AI. Banking, security, Netflix, Amazon, they're all using AI. So you yourself are already using AI. A lot of people might not be aware, but this is fact. So this is not tomorrow. This is today. This is this morning when you woke up. Let's change gear and move on to healthcare. What's in it when it comes to imaging or healthcare in general? Do we need AI in healthcare? We definitely need AI in healthcare, simply because we are lacking in the ability to provide our care to the needy. This is a map of the world, and the color coding actually reflects how good an access the population of each country has to healthcare. And the darker the blue is, the better. Where are we? This is Egypt and India, very light green, which basically is no man's land. This is where a population has 1 doctor per 1,000 population, even less. That's really low. Compare this with mid-Europe, 7 doctors, 7 times as much better access to healthcare. India, the Gulf area is not really much better. 2 doctors per 1,000 population. So with this lack in access to healthcare, we definitely need some kind of solution. We know we cannot recruit more doctors, but we have technology to make these doctors and these healthcare providers more productive. And imaging workflow, you're all familiar with it, and it starts with the scheduling, then the acquisition, and going on to the perception, which is diagnosis, and then the reporting communication. I will focus on the 2 main or 2 core steps, which are the acquisition and processing, and then the sexy part of imaging, which is the diagnosis, which everyone talks about. Let's see how AI impacts these 2 steps. With the acquisition, now with AI, we can reduce the radiation dose. And we know reduction of the radiation dose is the holy grail of imaging. We want to give our patients the minimum amount of radiation. Problem is, if we're brave enough to do it, we end up with ugly images like this, because so much noise would dominate the image, and we would have very low signal-to-noise ratios, and these images are virtually unreadable. You need a bit of a hero to read images like this. However, when we reduce the dose, we can seek the help of AI systems to remove the noise, and if you compare the image on the right side with the one on the left, they're nearly indistinguishable. In fact, the one that was handled with AI might be a little bit better. So you've reduced your dose by 80%, and I mean 80%. So rather than giving 100 units, you're only giving 20. Think what that means to your patients. Think what that means to the budget of your hospital. Now you need to change your tubes way less frequently. If you're changing your CT tubes every couple of years, now you probably need to do it every 10 years. That's massive saving for your budget, for your patients. Now, what about contrast media? Can we reduce the amount of contrast media just like we reduce the dose? Yes, we can. This is an image of an MRI of the brain using contrast media at full dose. The mass is beautifully outlined, beautifully enhanced. Now we go a little bit ambitious and inject 1/10 of the contrast. So rather than injecting the 10 ml, we're injecting 1 ml of contrast. Of course, the mass is virtually invisible. We cannot see it. However, with the aid of AI, we boost the contrast, and we have an enhanced image just as good as the one that was obtained using the full dose. This is how powerful AI is. If I say that dose reduction is the holy grail of CT, for MR, the holy grail is time. If we can reduce time, there is so much going on for us. This is an image of the posterior fossa taken at full time of nearly 6 minutes. Now we decided to slash the time by half or even less than half, and we get this lousy image. However, the patient is really happy, and the technologist, everyone is happy, but the reporter in radiology will never be happy with that until we subject this to treatment by AI, and now we have all the details back because we simply removed the noise. It takes an AI algorithm to that. It's not easy, but the algorithms are available that actually do just that. How about MR images that we're getting from low field MR? Can we do anything about those? Yes, the images on the left are coming from a low field MRI. Now we've doctored them using an AI algorithm, and you will see how much better that image is. It could be coming from a high field MRI for all you know. What about those patients who cannot lie still? And I think we see them every day. And we keep repeating sequences for them. And this man was really moving vigorously on the table. And we got these images, but we know the man was really in agony. We didn't need to repeat the sequence. We just needed to use AI to correct for motion, and we get these beautiful and diagnostically effective images. Now I'm back. This is a cliché image in every AI presentation where we see AI able to detect and triage fractures in emergency departments. So this is really pretty basic, although it's really important. And not only are we able to detect skeletal fractures, we can also detect osteoporotic fractures, but not only detect them, but also map them to DEXA scores. So now we can follow them up, and this is an opportunistic diagnosis of osteoporosis that is brought out of CT images. We as radiologists know how much time we spend trying to do all these odd measurements. Cob angle we're fine with, but what about the metatarsal angles? What about the hip angles, the shoulder angles? We really need to reach out for our books and try to find them. Not so easy. Now we have systems doing that and presenting them to us in beautiful reports such as these. Detecting and triaging chest nodules. The original image, not so visible, but with the help of AI, if you've got them outlined for you, you have no excuse to miss them. And just to prove to you the point that AI wasn't hallucinating, these are the CT of the same image, and you can see the atelectatic band. But not only that, the nodule was categorized using lung rods, and the management recommendations were given to you in a report that's pre-populated for you. Emphysema, you do not need to worry about missing out emphysema, because now AI picks emphysema and quantifies emphysema. Remember, for us radiologists, it's virtually impossible to quantify emphysema. Now we can, and this way, because we have numbers, we can follow it up. No presentation would be complete without mentioning COVID, and COVID, of course, can be easily detected using AI, but not only detected, also quantified for your follow-up. And the prognosis can be predicted. Can we measure calcium score? Definitely. And we could do it from low-dose CT of the chest, non-gated. We do not need a specific chest CT for that. From a standard CT, any CT chest, we can get the Agatston score for the coronary calcification. Beautiful images such as these show how good advanced visualization can be with AI from any modality. The last one is from a cone beam CT. Breast, and this is the last couple of slides. Amen. Okay. This algorithm can actually categorize the breast density for you automatically. I know the women's imaging professionals around us would be interested in this. And this is of importance because we know that breast density is a biomarker for breast cancer. So although you might not find a breast cancer in that lady, but at least you could have a biomarker for the likelihood of developing breast cancer. And of course, the all too important detection of breast cancers, but not only detection, but actually having a malignancy score that would actually guide you what to do with that patient and whether you can let that patient go home and come for her next screening the following year, or you would need to recall her. So simply, you have an aid that tells you what to do. In fact, that system communicates with the patient. And every radiologist dream a system that would write reports for us. We have it now. That was a patient with brain hemorrhage. The abnormality was detected. The findings were compiled. They were embedded in the report. They were presented to you as a radiologist. All you needed was sign that report. The auto-report generation. So the only thing left to do is all these findings, the systems would have them on your work list as priorities. So you would have prioritization which findings you need to to report first. And just in case you're not at station, critical findings are actually sent to your phone. Closing, I need to reflect of what AI will do for us in the future and how we can get our minds around it. I have 5 questions here, or 5 reflections. Can we accept AI as our new colleague? Can we accept AI as our new colleague? Because this is fact. Our AI is going to be our new colleague in the radiology department, I think in the whole of healthcare. And I think we have no choice but accept. But how are we going to work with AI? And just before you start thinking, that's an example of people working with AI. This is a paper, an article published in January this year, a couple of months ago. First paper where the co-author is actually AI, ChatGPT. First author is human. Second author is AI. So AI is already publishing research. How do we tackle technology bias? We tend as humans to trust technology more than we trust ourselves. But we've got to be careful. Remember all these GPS recommendations taking you back home or to a friend's house where it messes up everything, but we still stick with GPS, so we need to take that into consideration. And then, who is responsible? We need to know who is responsible. Is it us? Is it AI when we make a mistake just because we followed AI? Big subject of debate. The last thing that I wonder whether AI will bring in the next step in our evolution, which would be, I believe, the connected human beings. And I believe rather than judging ourselves as humans or differentiating ourselves based on IQ, I think we'll be differentiating ourselves based on TQ. Normally, I would ask if anyone knows TQ. I think the younger generation will know. This is a technology quotient, how good we are with technology. This would be a differentiation for future human beings. Now, as I close, I just want to tell you that AI's remarkable advances will transform every major industry. It's the new electricity. Think of life before electricity, after electricity. This would have even more of an impact. When it comes to healthcare, AI will automate tasks in healthcare involving routine manipulations. of information. So all these tedious tasks will be automated by AI. However, tasks demanding creativity will be enhanced by AI. So AI will still be there, even when creativity is needed. Working with AI. Sorry for taking so long, but I tried to really cut it short. I hope you enjoyed it, and thank you very much.
Thank you, Dr. Ahmed, for your excellent presentation. The next speaker will be a recorded lecture by Dr. Luis Donoso. He is the Director of Clinical Advanced Technologies Institute in Barcelona. He is the past president of European Society of Radiology and Spanish Society of Radiology, and he is the past director of Medical Imaging Department in Barcelona University. Professor Donoso.
Invitation to participate in this interesting